we've done them. Yes, we did those two. We've done hemoptysis, which is coughing up blood. We've done, yesterday we did pulmonary edema, which is fluid in the lung tissue, and pleural effusion, which is fluid around the lung tissue. And we saw like the different conditions that may cause that. And we've done alcoholism, okay, alcohol use disorder, and some of the symptoms. We've done pulmonary fibrosis, which is scarring of the lungs. We've done thromboembolism, so blood clots. So we've done a good number of topics. Okay. And so we'll kind of, there's so many things that, in these topics, there's so many questions that people can ask actually. But just feel free to ask questions, and if we're able to answer them, we'll do that. So Dr. Chudi, they asked you a question in the beginning, the very first, and this was from, it looks as if he's a physician. He did say, if I'm able to put that up. He says a doctor, I thought I saw it earlier. I hope that there's no, sometimes maybe, okay, Dr. Sue. So Dr. Sue asks, hi doc, asking for a friend. Can a woman still conceive with less than one anti-Mullerian hormone level?
I think the same person sent it as a message to me. Yeah, so here's the deal. Anytime we are looking at numbers do not represent absolutes. So numbers are guides, right? Now, when we look at the anti-Mullerian hormone, it's one of the markers we use in checking the quantity of eggs you have remaining in your ovaries.
Okay, Dr. Chudi, sorry, let me just do a little announcement here. Aruade Casa, you're not even following me, okay? So in order for anybody to ask a question, please, at least give me a follow and a heart me, please. So that at least you're getting like free, free knowledge. So if you all want to ask a question, at least join and give me a hand, me, please. Thank you. Thank you, Dr. Chudi.
Okay, Doc. Thank you, Doc. Please make sure you follow those simple things. They're very, very simple. So when you're looking for a baby and you're not able to have a baby, and you present with infertility. So infertility is the inability to achieve pregnancy after a period of 12 months if you're a lady and you're below 35. And after a period of 6 months, if you're above 35, so if you're not able to become pregnant with your partner, despite the fact you guys are making love without protection, at that point you have infertility. So one of the most important tests we run for women that present to the clinic is what we call ovarian reserve check. So ovarian reserve check simply means when you were coming into this world, God gave you millions of eggs, out of which you're supposed to use to start your family. But because you're gonna be losing them, and when you ovulate, when you lose eggs, you don't get them back. So over time, they're gonna deplete. So the question the person asked is, if the number is below 1, normally we want the numbers for your anti-Mullerian hormone to be above 1, and it's also age related. So age is one of the critical factors I would like to know about this patient. So now, does it mean that once your anti-Mullerian hormone level is low, then pregnancy is completely gone? No. There are still so many women that will have low anti-Mullerian hormone and they can still become pregnant. It's just one of the markers that gives us a wake-up call that the numbers are reducing. So there are still some women that, despite the fact that the anti-Mullerian hormone level is low, they can still become pregnant. Now, the only time we can say for sure that a woman's ability for pregnancy is gone, it's if you have not had your bleeding for a complete 12 months consecutively, then you've got into menopause, regardless of your age. So this person still got a chance to go for evaluation. Then we look at a couple of other parameters, and pregnancy can still happen both naturally and with help. Thank you.
There's so many things. Did you have, or is it Pamela? Someone had a question?
No, I had a question about what is anemia. I just want to know what anemia is.
Okay. So that's low hemoglobin. So when you have hemoglobin is a cell that carries a blood, carries responsible for red cells, red blood cells. So when you have low hemoglobin level, then they say you do have anemia. And males and females are a little bit different. Generally for females, 12 is what is considered normal, males 14, and it's relative then when it's low and high. So anemia is just low hemoglobin levels.
Correct. Now, to also add, the function of the hemoglobin is to carry oxygen to the whole body. So when you're anemic, there are a couple of other types of anemia you can have. For example, there are some women that bleed heavily. So when you lose a lot of blood, probably because you're a heavy bleeder, and that's actually the reason why the level for men and women are different. So men is mainly 14, based on what Doc said, and women is below 12. So when you're losing a lot of blood, you can have blood loss anemia. Now, the component we use in making blood, iron plays a lot of role in it. So when you also have iron deficiency, you can have iron deficiency anemia. So then there are a couple of other things that can lead to anemia. Just bottom line, it's when their hemoglobin level, which is the oxygen carrying capacity in the blood, is reduced, then you will be said to have anemia. And it's a very important thing we need to address. Thank you.
Thank you.
Okay, thank you, Dr. Chudi. So anemia also, so the reason, sorry, I'm really be distracted because I'm trying to do like moderator work and as well as like, yes. So yes, anemia is low hemoglobin, and yes, the oxygen hemoglobin is important for oxygen carrying capacity. Now you have to also it can be an indicator of something bad going on too. In women that of reproductive age, yes, if you're having your period, you can have some degree of anemia, especially if you have maybe heavy bleeding. But as you get older, especially when you start having anemia, you want to find out why you're having anemia. And there are different types of anemia, depending on what is causing it. Okay. If, for instance, for someone that's, say, an alcoholic or someone who doesn't eat really well, they may have anemia for a different reason, which they may have folic acid deficiency, they may have vitamin B12 deficiency that can cause low hemoglobin. For a female, they have it for a different reason. It can also be a sign that you may have to make sure that you don't have something as bad as a colon cancer. So when you have anemia, you want to find out why you're having the anemia. And sometimes you may have to see your doctor to do different tests that will give them some idea as to whether it's from iron deficiency or maybe folate deficiency or B12 deficiency, or just chronic diseases. Even if you have kidney problems too, you can have anemia. Because the kidney is important in producing erythropoietin, which is important for your red blood cells. So different things can cause anemia, and sometimes if your blood levels are so low, hemoglobin levels, you may have shortness of breath, and some people can even pass out from that. So yes, it's something that you have to make sure that you're not developing or you don't have an ongoing problem that is serious.
Correct. And also sometimes you might have a condition that might be destroying your blood cells rapidly. And when you have such, you can be classified as having hemolytic anemia. For example, some people that have abnormal genotype, like you're not a trait, you have sickle cell disease. Because of the shape of that particular hemoglobin, they will be getting destroyed faster. So there are certain situations that will predispose you to such. And there are some people that will have quite severe anemia that might need blood transfusion to have a chance. Because if you end up with lack of enough blood. Of course, remember what Dr. BNS normally says about if you're not breathing, you're not living. So there will be a time you might have severe problems to even breathe, and you might end up going to the ER or critical care to see her.
Okay.
All right. Thank you, Dr. Chudi.
Chudi.
All right. Welcome, Larry Boy.
Dr. Chudi, where are you located?
Thank you.
I'm in Florida.
Okay.
All right. Anybody else? Otherwise, I brought up Awurade up because he did ask a question and I did not understand it. Awurade, welcome.
Maybe I have a question about following up with anemia.
Okay.
I was asking myself, is there like a type of foods or drinks that you can drink when you have? I was, because I remember one of my friends who has anemia, and he was telling me like he can't drink coffee, he can't drink Coke, stuff like that. Or he can't eat cheese. Yeah, he was telling me this kind of things.
Really?
I mean, I think there are some foods that are rich in iron. You know, something they can easily Google those, and if people have different they have different food items that are rich in iron. On top of my head, I mean, I may guess by saying some, but you can always Google some of them.
Yeah.
I mean, yes, but the foods that are rich in iron, it is very easy to find out that. But I'm not sure about the coffee. Why you can't?
You know what he asked is the one they should avoid, and I can't remember anything that coffee has to do with anemia.
Yes.
Now, food-wise, you should consider food that are very high in the components we use in making blood. So things like leafy green vegetables, very, very good source of getting the iron, which is a component we use in making blood. Now, some people can also have microcytic or megaloblast. I don't want to use those big names. So there are a couple of deficiencies like vitamin B12, which is also part of a component we use.
Macrocytic anemia. That's what
I'm trying to make sure I don't use all the big grammar.
Microcytic, normocytic.
Correct. So you can actually, give yourself a chance by what you eat. And just like Dr. BNS mentioned, if you're anemic, you don't have any business going to drink alcohol because alcohol is going to make you worse.
Right.
So, yeah.
Yes, but like Dr. Chudi said, yes, leafy food. Maybe some meat, beef or something.
Yeah, beef, yeah.
Yes.
But the major one is leafy vegetables.
Vegetables, yes.
Yeah. And of course, I'm
so
going to give you some iron
you guys because it's almost 2 a.m. here and I'm starting to feel like sleeping.
No problem.
Okay, think about it.
Thank you for coming, for joining. Thank you very much.
Thank you.
Yes, I'll adjust my life to from now henceforth, since I'm off also, to accommodate everybody.
Thank you.
So it's not too late. Yes. Thank you.
Children.
Or what happened to Awurade? I myself, I give birth 15 times and I get 20 children. I'm 43. Okay. Let me bring you up. I don't know what happened. He dropped.
20 children?
I'm calling him, but it may be a hand. Awurade, welcome.
Hello? I want to talk to you. Please go ahead.
Yes. Welcome. Yes.
Thank you, ma'am.
Mm-hmm.
Yes.
Please, I'm from Ghana.
Mm-hmm.
Okay.
My name is Faustina.
Okay.
So I'm not understand what is going on in my life. I gave birth 15, but for now I have 20 children because of twins. They are 5. And single 10 and 22 5. But some people they are insulting me why I give birth, but I don't know what happened to me. If I have sex, only one cry, I give birth. Now my husband dead, and he left that 20 children with me. So I don't know what I do any medicine it can't do it. It can't. It can't. Hospital medicine, herbalist medicine, but it can't. The small one, they are now 1.5. And they said they will do me CS. But the time they will come do CS, the CS, they be Christmas Day. So no doctor around. But I give birth myself. So I'm not understand. What somebody needs some no get. But why? Why? So I want to ask the doctor. So somebody can give birth like that, or I don't know. That is why I say I want to ask the doctor. Mhm. That is my problem.
So what is your question? That why did you give birth to 5 set of twins, or why did you give birth to 15 children?
Yes, why? If somebody is they have that, somebody can give birth like that. Because
So you've been
I think
pregnant.
what she's
You've been
trying
pregnant
to
10
say,
times. Yes.
what she's trying to say is maybe birth control that she has tried isn't working. They didn't work out, both the herbal and the orthodox process that she has followed. None of them work. That's what she's trying to say.
It can happen. That is why I want to ask.
My doctor, I wanted to ask if anyone from Ghana that is watching from FYP on the comment section, please indicate yourself so that we'll bring you up. You can translate in Ghana. Please.
Yeah, the truth is that I'm just trying to understand because the numbers are not adding up. If she has 5 sets of twins and she's telling us she has 20 kids, that would be in CNN. And I don't know, it's just
Maybe maybe she's in an area that doesn't even have exposure. I don't know.
it's not. I'm trying to grapple.
So you have 20 children.
Yes, I give birth single 10 and 2 5.
5. So 20 children.
Yes, that one they are small. That twins all they are small. With 5 sets.
Okay, how old are you?
43 years. 43.
43. And
Yes.
how old are your oldest kids?
Oh, first one now she's going to say 28.
28. So when
Yes.
did you have your first twins?
My first twins, they are 15.
15.
Yes.
Okay. Can you please take a moment and run down from the oldest to the youngest? And is it with the same man you had all these babies, or with different men?
No. The same man.
Okay. So start from that the 20th one. Give us a sequence. So did you have single, twin? Just give us a sequence until you get to the 20. Let's understand it, please.
Well, first time,
Doctor,
the first one, the first one is now she's going to 28. It be 1999 or so. 1998.
Okay.
She's going to 28. The second one, they are going to 26. She's
Okay.
26. She's 26, going to 27. And the third one is 25 or so. Me, I write it there, but I didn't see the paper. I write all their.
It's okay. It's okay, my sister. So when did you have your first twins?
They are my first twins. They are 10th February. 2010.
Okay. So the last pregnancy you had, were they twins?
Yes, they are one boy, one girl. They are twins.
Okay. And you had all these babies through. Did you have any baby through the vagina, or you delivered all of them through CS? CS?
No, I didn't do CS.
You had all your babies, all these twins through the vagina? 20 babies through the vagina?
Yes. I didn't do any CS.
Interesting. Okay, so we're gonna still continue. So what can we help you understand? You're 43. You've had 20 babies.
Liking and sharing, please.
So what's your question, and how can we help you this evening?
Some people they insulting me because say I give birth this child, so I can't take care of them. Their father dead. The small one I give birth, they are 1 month before their father's dead. So later I go. Some people I go market, so I don't have anything. So the people they are insulting me. How can you give birth that? I try every medicine. It can.
Okay, let me ask you, my sister. Your husband, before he passed, what was your husband? Was your husband able to provide for you and your plethora of babies? So what was the motivation for having all those babies? Like an average.
Dr. Chudi, I'm sorry, I don't mean to interrupt. I think what she's trying to ask is that she tried to use both conventional and non-conventional methods, and but could still ended up still getting pregnant. Meaning she took traditional, she took what the doctors gave her, but she was still pregnant. Is that what you were asking?
Yeah, and she also said, let me add to it, Dr. BNS, and then she also said how another thing is that even if she goes in one time, she gets pregnant.
Yes. So she was trying to find out why is it like. I think it probably boiled down to know what is it exactly that she was getting as birth control measures, or doing as birth control measures.
Let me ask a question for Dr. Chudi. Is there a condition that some women are born like that are highly fertile?
It's not a condition. It's a kind of a genetic predisposition. So women have high fecundity.
But doctor tell me that if I didn't take care, I will give birth again. So
yeah, I'm coming, my sister. So there are some people that have high fertility. So high fertility is the ability to become pregnant. High fecundity is the ability to become pregnant and have the babies. So if you guys notice, I was asking about the method of delivery because it's kind of unusual to have all this baby through the vagina. And when we are talking about contraceptives, we have long-acting contraceptive and permanent contraceptive, which can be applied to both parties. And we are talking about people in Ghana. So the man would have been a candidate for vasectomy, and she would have been a candidate for BTL, which to an extent BTL can fail, but at least he has like
what is vasectomy and what is BTL? You're always the one telling us to avoid those big terminologies, Dr. Chudi.
Yeah, I'm coming to explain it. So vasectomy is the process of stopping the flow of sperm inside the penis so that the man will not impregnate the woman. BTL is bilateral tubal ligation, the process of tying the tubes so that sperm cannot come in, the eggs cannot come in, and pregnancy cannot happen. Both of them are supposedly long-acting permanent contraception. So in a place like Ghana, even the most wealthiest people will find it difficult to go. But she's still 43. And yes, if this is a very confirmed situation, possibility she's gonna take it again is very high. So and the age gap between the older ones and the younger ones are quite far. So she has babies. She should actually be a grandmom by now, but as we can see, she's still having babies. So how long have your husband passed?
Please, January for 2025. January. So I give birth 25th December. December 2024.
Okay,
And the next month he passed away.
Okay, that's still fresh. And you're 43. So when you gave birth to that last baby you had, did they discuss with you how to make sure you will stop having babies? Like, did they give you options of permanent contraception? Did they tell you they will tie your tubes?
They tell me that if they will do me CS and they will do that, they will turn the womb for me. So that time, they be Christmas Day. Doctor no around. So the time they come, Friday 27th. So I give birth. So they didn't do me the CS. They didn't do me anything. Now, as for now, so if I go and take any manner, I will get pregnant. So I don't like to go that place. So I'm not understand. Because I beg food before give it to my children. I do work, but the work has spoiled because of the children.
Okay, what we are talking about now is not even just about the children, it's about the quality of life and the ability for you to be around. So you still have to go. So do you have access to a gynecologist that will offer? So do you have access to a doctor that will assess and still go out to tie your tubes? Because that's what you need to do. We need to tie your tubes. We need to tie your tubes to save your life, because your life is also in danger now with all these multiple babies you had. So that's the permanent thing they will do. If your husband were still around, we are also going to advise him to tie his own tubes too. So both of you will tie the tubes so that even if you continue to make love with your partner, you will no longer have that ability to become pregnant. That's the most reliable option you have now.
Okay. So now no husband. I don't have husband.
So now you don't have husband, so you have to abstain. You have to make sure, but this is also your personal life.
Your tubes. Or you tie your tubes, because
it's your personal life, so I can't tell you not to have your relationships, but you can become pregnant again. The way it's going now, you have very high fertility and fecundity. If you make love to a man right now, as I'm talking to you, possibility you're going to become pregnant again is very high. Now, do you have family history of twinning? Is there anybody from your mom's side twin? Did your mom have a lot of twins?
No. Only nobody. Only my mother born me.
You're the only child?
Yes, I'm only child. So as for my children, 4 days with my mother. So they are staying with somebody, and 10 with me now. So the water flow the Ghana. So he came my room. So they go and stay somebody.
Do you have a picture of all these your babies together?
Someone actually said it, that she was in the Guinness Book of Records. Somebody said down here. Yes.
Okay, it's good that she happened on this clinic. So it's a case we're gonna actually dissect more in our various platforms. But ma'am, you have to really be mindful now. So the game plan is to look after these 20 kids and make sure you have quality of life. But the most important thing we have to do for you now is to make sure you don't get pregnant again. Now, at some point, with your husband not being around, you're going to have a need to have a companion. But the companion has to be well defined, because we need to make sure you are around to still have your kids. Because your womb has really been through a lot, bringing forth all these babies. So we want to make sure you have quality of life, that nothing will happen to you, so you can still have a time for your family. Now your husband has passed. What kind of work do you do to help you in sustaining the baby, the children?
Oh, now that you go, sometimes you go, but they are small. Now they grow up, so I won't find money to start business. That time they are small. So the money, I get it. So we eat. And the market people, they help me for corn and this thing. But now, dear, I want to start something, but I didn't start. I use some buy soap, everything. So now I don't have money to start something now. I don't have money. So the place I stay to the water came there. So we go to one of sister neighbor here. And I sleep with her.
So, my sister, what's your first name?
My first name will be Faustina. My name is Faustina.
Okay, Faustina. Okay.
Yes.
Now, what we are doing now is more like question and answer. So, what immediate thing can we help you? Like, what immediate
if I want to start work, it's not any time somebody will give you. So if I get something, I want to start to. I know how to they do cocoa. I know how they cook rice and everything. So
okay, so right now, for what we're trying to do, we are doing questions and answers, and I quite understand where you're coming from. It's a valid request, but what we are dealing with now, it's like questions on medical issues and all that. And I'm also gonna ask you this. So have you been around in other communities in this app? Have you gone anywhere to tell your story? Have anybody helped you and your family? And if it's in the news, what level of community help have they given you? Like your church, your community? Do you have family like your sisters, your brother, your mom, your dad,
no,
your siblings?
my mother there. My mother didn't stay here, so now she take 4, stay with her, take care of them. I don't have sister, only me, my mother born. So all my children now they stay with somebody. They stay with somebody. Only 10 stay with me.
Yeah,
only
I understand.
10.
I understand. So like the reason why we showed up in Dr. BNS is, matter of fact, this Q&A is supposed to hover around her own area, so what I would advise you to do, still stay in the, stay around, and we'll run the Q&A for now. Then at some point, you're gonna need social help at a much more organized level. But right now, we are not running like help to people that have need. We are just providing medical help, medical questions and answer help. That's what we are providing. Yeah.
Okay.
And you have the Tony Foundation here actually, although he may be busy also. So have you linked up with? You've heard with On God, Tony C Foundation. So do you want to follow? He's actually maybe not. I don't know if On God is able to talk. He's actually probably on another show, but his page is here. The Tony C Foundation that you see there, you see that this person in the inbox, that says Tony C Foundation. Can you follow him and link up with him as well?
Okay.
Yeah, he's just directly below your box. Yeah. So we've already had 2 questions regarding reproductive health. Let's take some other questions before we'll come back to any reproductive health questions. So Keisha, for now, we'll hold off on your question. Let's take some other questions and then we'll come back to reproductive health. Any other questions that are not reproductive health related? And please make sure that you actually grab a hat me before asking the question, at least, to show a little bit of support. All right, so Millie Sweet, you want to come up for your question or you want to ask it in the comment section? Let me know.
Doctor, let me just ask this one for people in the FYP and people in the comment section. What is someone asked that? What is the purpose for vaccination?
Okay, depending on vaccination in general. Is to protect you. So the whole reason, first of all, when you're born, okay, everybody has, you could say, 2 defense mechanisms, or what they call an innate, meaning what you're born with. And little children will usually have that. and then also what you develop over time, okay? Or a secondary immune system where if you get exposed to something, then your body will react. So the whole purpose of vaccination is when you get vaccinated with something, for instance, influenza, okay, they'll give you they'll either give you the some of the proteins, or they'll use proteins of some of these different bugs that can cause serious infection, and either make it inactive, make it in such a way that it wouldn't really hurt you, and then introduce that into your body, and your body will recognize it as a foreign something, and then produce, and that stuff that they are giving to you is called an antigen, okay? Your body now will produce now antibodies. It will produce now it's something, a defense mechanism that will now go and attack that, and in that process it will also have some what they call memory cells, meaning that it will have a memory of that organism or that protein that came into its body that was foreign. So the next time that you get exposed to that same, when you come truly, let's say for influenza, you come across someone that has the flu, okay? It will take now a shorter time, not only your initial, those innate immune system that you have, the cells that will come in to defend, you also have those antibodies that had a memory of that flu antigen that was used before, and then you have now a more robust, it's almost like you have a backup. So the whole purpose of vaccination is not to prevent you from becoming sick, because in some instances you'll still be sick. But the whole purpose is that when you're sick, it shouldn't be too bad, because your immune system is able to contain that fast enough before it replicates. Because what sometimes will happen is that when a virus comes into you, like even the COVID, or a microorganism comes into your body, it will now try to hide away from your immune system. It will try to maybe multiply and overwhelm your body, and your immune system may not have the time to fight back. So one of the important protection that a vaccine gives you is that it already knows, it has already seen that particular microorganism, but not in the form of a live microorganism, in the form of some of the proteins from that microorganism. So you now have an immune system that is ready for it when you come in. So it does reduce, it doesn't necessarily eliminate you getting an infection. Sometimes it will, but it will reduce you getting too sick if you actually get infected and you start having symptoms. So that's the general purpose of vaccination.
Therefore, it helps fight. It helps.
It helps yes, it helps to fight and fight fast, not just fight, because sometimes it will take weeks if it was just left to your body, seeing that particular microorganism that came into you for the first time. But because you already have a memory of that stored somewhere, because they had seen it before, it will take a shorter time now to have a backup from your natural immune system that you first had, what they call the first line of defense. You now have that's like a second line of defense that will come in together to contain that infection, so that it doesn't replicate or it doesn't overwhelm your system.
Thank you.
And also, that's also a very important opportunity to talk about the role of mothers. So the first line of, do we say inoculation or vaccination, protection? The first layer is what the mother actually does for the baby. So Dr. BNS mentioned the innate role. So that's the one the baby came into the world with. Now, when we tell you to give your babies breast milk for 6 months, inadvertently, when you're doing all that, you're also fortifying and you're also making sure that your baby is getting all the immune components that will protect the baby. Because that breast milk is actually the very first compiled way that God is trying to make sure that baby is going to be fine. Then also just to break it down further, Dr. BNS also mentioned the types of vaccination or immunization you can get. So it can be, more like a life component of what we are trying to prevent, but it's not going to be in the form that will cause more problem. You're just going to be in what we call attenuated life, or it's going to be a acute component. So the idea is to use that particular thing that will drag out that disease condition so that your body will build the soldiers. So see it as soldiers trying to find invaders. So ahead on time, we prepare the soldiers so that once, like she mentioned, there is a memory, a reoccurrence of that thing coming up, the body will go and attack. Unfortunately, for some people, depending on their religious background and their cultural beliefs, some people don't believe in vaccination because of some of the, false claims about connection with vaccination and a couple of other things. But it's actually the reason why we are still standing today because of what we got when we were growing up. Some of us wouldn't have made it if we didn't get all those vaccinations. Thank you.
Thank you, Dr. Chudi. So just another housekeeping announcement. Abena Tilda, I see you. If you have a question, make sure that you join and you grab a hat me. So we'll answer your question. So at least try to support the show by joining and grabbing a hat me. So Abena, I see that you're not even joined. So please do that. Welcome, Millie Sweet. You said you had a question.
Yes, ma. Good evening, ma. Good evening, everybody. Yes, ma. Sorry, ma. I want to ask. I once have a pie. I was having a serious constipation and I have pie then, which I was unable to go to toilet and the rest of the things. So although it was treated, but I still have a boy that is still stuck in there through my anus. So, but I noticed that usually if I'm menstruating, it took like 3 days, and then now my menstruation has it's just like sometimes it's 2 days, and the third day it will just like the first day itself, the flow is not much, it's just low. So I don't know if it is because of the constipation and the pie or it's just a normal flow. I don't know. That is just my question.
How old are you?
I'm 32.
Okay. So, okay, I think these are two different things. So are you concerned about your menstrual flow being that you don't have as many days for your period? And you're asking if maybe the fact that you're having constipation is causing that?
Yes, ma. Yes, ma. Exactly.
Dr. Chudi, that's your area.
Doc, you were shaping your mouth, so I was. Yeah, Doc, you were shaping your mouth, so I was hoping that you would tackle it.
I mean,
okay, so
I'm trying to be. I mean, there are so many things to first of all, I know you're going to start asking, have you ever, how long she's had her menses? Does she have any children? Does she have hormonal problems, the TSH, and all of that? So that's why I'm like, that yes. So I think it's more of a reproductive question than I don't know if she really just wanted to tie that by there because I said I don't want any reproductive questions anymore until we have other questions.
That's why I was even standing out. I didn't want. I wanted to have other questions before this, but let's do justice to that. Then she's already in the box. So here's the deal. Millie Sweet, correct?
Yes, that's her name.
Okay, so. The two places you had your concerns are not connected. They would have been connected somehow if you have some abnormality, but you don't have abnormality. Your period running for 3 days previously or 4 days and suddenly is running for 2 days is still okay. It's when your period is running for more than 7 days or just running for 1 day that we begin
Dr. Chudi's network.
Hello? Can you guys hear me?
But we're getting you now.
I hear you.
Yes, we can hear you.
Yes.
We can hear you now. Yes.
So the point I'm making is the two areas you had concerns with are not connected. At least everything presenting it looks normal. So when you're bleeding, if you're bleeding up to 2 days, it's considered normal, the lower limit of normal. If you're bleeding up to 7 days, it's considered normal, the upper limit of normal. When you're bleeding for more than 7 days, then that's when we begin to worry and we begin to go and check and see what's going on. If you're just bleeding for 1 day, we also want a query to know why. Now, the pile you had, so what you had medically we call hemorrhoids. Did you go for official medical consultation and they treated you appropriately? Were you operated on or they gave you some cream for it? How did they manage it?
Yeah, they give me some cream for it and drugs. Apparently, I took it and I used. They give me one that I inserted it, but sometimes it's only when I'm expecting my menstruation that you see I will have that constipation. I will have that pains. But after my menstruation, I'm normal until I'm expecting it again.
Is she talking about maybe premenstrual pain or is this?
Yeah, that's what I'm trying to figure out if it's premenstrual or even endometriosis. But what you need to do, the hemorrhoids you have can be independent of your period. Now, because the whole area where you bleed and where you do number 2 are all connected, they are all called the perineum and the pelvic. So everything that is connected in the body will feel things when any. So like there are some women that during their bleeding, the whole anal area and everything will just be, uncomfortable. But your period is still normal for the 2-3 days, 4, 5, 6, up to 7. Now, what I will advise you to do, you still need to go for consult, and possibly when you see your doctor, they have to refer you to a GI specialist. A GI specialist is a special doctor that looks after from the mouth to the anus. So they can take a critical look and if need be, have a look inside to make sure that everything is okay for you. Now, have you gone to see a gynecologist for a while now?
I do. They check inside. He said, "I'm okay, but I still the part is not like." He said it's through because of the pains that force this thing. There is just one tag, something that is just hooked there. But he said they cannot operate it. Even if they operate it, we still come back because he check it thoroughly.
Okay, so that means you've seen the gut doctor, right?
Yes.
You see the doctor that took a look at that place and they gave you the suppository. So what you put inside your anus is what we call the suppository. So since you started using it, did you notice any relief?
I do. But it's just that I'm not feeling it until if I'm expecting my menstruation, I'll start feeling pains again. That is
So that's why we're trying to tie together. So you heard one doctor mention PMS. So there's something called premenstrual syndrome. So if this is related to the time you're bleeding, then we have to also follow through with a gynecologist. Let's do a comprehensive workup to see if we can discover if there is another thing going on that might be connected. But for now, the two systems are not really connected for now. So follow through with a gynecologist. When was the last time you saw your gynecologist?
Since last year. Sorry.
Where are you based?
Nigeria, in Abuja.
Okay, you have to book an appointment with your gynecologist with this new observation. So let's make sure everything is okay with you. That's your next port of call. And then you follow up with the GI, the people that looked, like when they gave you those suppository, they asked you to take it for some time, right? I think our connection is bad. Doc, I think you can move.
Okay, maybe help. Yes.
Move to the
Okay.
next question.
I'm trying to see if I have any other questions. I know there was someone who wanted to ask a question. They wanted to ask a question, but I did ask them to. Let me see if she's now. Okay, so she. How do I, Pamela? How do I know if someone gave me heart me?
They're gonna be showing orange.
Yes, I see. When you click on them, I see level 0 and member 0. And well, member, I don't see the member is grayed out.
Comes to this live stream and gives a heart me, it's gonna be showing your orange on them. For example, like
if I click on their name, I'm seeing gray. That means they are not member, right?
No, when it's
if you see gray, they've not given.
One. For example, if you look at Larry, look at how Larry's name look like. You will see that they did send heart me.
Okay, yes, okay, so she still hasn't. No, I just wanted to confirm. Yeah. Yes. Yes, so she still hasn't. Yes, Abena Tilda, I know that you sent me a follow. Okay, she just, yes, but you have to grab a heart me, and then we can go ahead and address your question. Just try to support. Thank you for your understanding. If anybody else has a question, please, we'll answer your questions, but just try to support also. Thank you for the likes and shares, but it doesn't I think I don't want to say it doesn't cost you to hard me, but it costs really minimum to give a hard me for the information that you're going to get and for what we're sharing out here. So please try to support. Thank you so much. And Awurade, you're welcome. You're welcome. All right. Like and share, please. Like and share. Thank you. Thank you for the hard me, and thank you for the shares. And then Dr. Chudi, maybe we'll answer the fibroid question while waiting for any other question. So Keisha, let me see.
Okay, sure.
Okay. So Keisha.
Okay, do you have?
Okay, go ahead.
Question? Let me just ask.
Somebody has
a question. Maybe it's gonna benefit every person. Most of them in the comment section. What if somebody want to ask, what is a fever?
High temperature. so it's a temperature above, we have, I think, this cutoff is it depending, I'm going to talk about Fahrenheit or Celsius.
37.2.
Yes, is it 37.2, 37.4, but it's, and it's actually also a method of, it's a way of the body responding to say an infection or something that, yes, because it doesn't necessarily have to be infection. You could even have inflammation. Even the pulmonary embolism can cause fever. So it's a stressful situation. It's probably an adaptive way that the body uses to defend itself. And right. So it can be anything that stresses. It doesn't have to be a fever. It can be, it can be if you have a lot of inflammation going on, if you have anything that, if your immune system is activated in any form of shape because of some stressor, some external stressor, you can react with a fever. But it's actually a defense mechanism. And in fact, there have been controversies sometimes as to whether you have to treat the fever, because they look at it sometimes like a defense mechanism, your immune system trying to protect you.
Yes. Yeah, you couldn't have explained it any better. So our body is structured in such a way that every second there is something happening and our body is taking care of it. When the immune system senses something that wants to destabilize the body, the immune system will start fighting. So the immune system will go and mobilize soldiers. So in case of those soldiers fighting, our body will begin to respond differently. So fever is one of the manifestations when the body is overwhelmed by foreign things. It can be infection, it can be inflammation, it can be destabilization in how the body works. So it's just a protective mechanism. And based on what Doc mentioned, fever can be protective, right? And sometimes if we treat the fever, we are masking the symptoms. So sometimes we'll allow the fever to run its course. The only problem is that depending on the population the fever is happening, if we don't control fever, sometimes it can also cause some problems, especially in tiny population. It can lead to convulsion. So fever is a very, very big, topic in medical practice. So it can take a lot of shape and form.
Thank you, Dr. Chudi. And thank you all for your engagement. I see here it says, and maybe Pamela will tell me what this means. Your fan club has completed the second stage of the Heart Me Challenge. Club Power has been unlocked for all fans to send and celebrate. So that's really good, right? That means they've been engaging and being, yes. So thank you all. I really appreciate it. Thank you. All right. So let me see if we have any other questions. If we don't have another question, then we can go to the reproductive question that was asked earlier. Pamela, did you say someone asked a question before you answer?
I was saying that since no one has asked a question, let me just
okay.
this one about
Okay. I just want to make sure I didn't miss it. Okay. So I'm going to let me see if I can see that question that was asked about earlier. I don't know if Dr. Chudi, you can. I will search for it too. I'm scrolling back. Okay. Kisha. I don't want to. Kisha, now. Do you want to come up? Let me follow you by that. I'll bring you up for you to ask a question, if you're still around. She said after I gave birth, the fibroid shrink, but when I'm pregnant, it grows and it becomes insignificant.
Yes,
so
I'm
welcome,
around.
welcome, Keisha. How are you?
I'm fine, ma. Good evening.
Good evening. Yeah, go ahead and ask your question, please.
Okay, my question is, right before I got married, I was diagnosed with fibroid, though it was almost insignificant because it was just 2 cm, just quite small. So, but I got pregnant, and though I had 1 or 2 miscarriages prior to my delivery of my baby. So, but then after I gave birth to the first child, while I was pregnant, I had a very painful pregnancy section. I don't know if I used the right word, but it was quite painful. Because of the fibroid, I was placed on pentazocine almost every time. I was always taking penta just to ease the pain, and I was also on cocodamol. But after I gave birth to her, I went for a scan because the doctors that they delivered the baby, they were like, "Madam, you have to remove this thing before you take in again and all that." I said, "Okay," but when I went back for scan before the second baby, it was small again. It shrunk to almost that insignificant, because I know they said the fibroid needs to get to a particular size before they remove it. So it was still small again. And then I now conceived again. But while I was pregnant again, it now grew. It now even became 2 times what it was with my first baby. In fact, the delivery of my second child was a miracle, because even for the baby to survive and for me to survive, it was a miracle, because I ended up with placenta previa, placenta abruption, and all the big grammar they were speaking, because I was bleeding at 7 months. So I was in the hospital for the remaining 2 months until I put to bed. So my question is, why is it that when you're pregnant, it will go? When you after you deliver the baby, it will now go back to a very small size, to now shrink and go back. In fact, whenever I go for scan to say, okay, they should check, so that if I know if it's too big, I don't mind going for the myomectomy operation and all that. But to say it's not big enough to. Though I've not gone for this one because I just had a baby 3 weeks to 4 weeks ago. That's the second child. So that's my question. I'm just curious because of what I experienced in the first one, where I went for scan to check if I have to remove it before getting pregnant again. But it was small, and almost the doctor said I should just go. It was quite small. So I'm just curious to know why it shrinks after delivery, and whenever you're pregnant, it will now be growing, getting big. I don't know if the question is significant
It's
enough.
for Dr. Chudi. Yeah, it is significant. Yeah, it's a good question. Probably has to do with the estrogen and hormone levels, but Dr. Chudi, you're more expert at this.
Yeah. What I'm gonna do, hold on. So let me use the teaching model to explain it better. Give me 1 minute. Let me explain it better. And
I'll put
the
you in the big
decision
box.
the decision of removing or not removing is not for you to make. It's actually the call that the doctor should make. So let me use the teaching model to explain it. Hold on.
Thank you all for joining. Please like and share. Grab your heart me, engage. Try to push this page, please, so that at least, the information that we're giving is very, very important, especially for us, our own people. We are able to understand ourselves better, able to relate better. So try to push this channel so that more people can benefit from it. Thank you all. And if you have any questions, put them in the chat. If you think that you want to come up for a question, let me know as well. Make sure that you grab your heart me also before you ask a question. Thank you. Thank you for supporting the channel.
Yeah, thank you,
Go ahead,
Doc.
Dr. Chudi.
So can you all see my teaching model?
Thank you, baby. Yes.
Okay. So if I understand correctly, did they tell you the type of fibroid you have?
Kisha.
Yes. No, she just shared the live, so she may not have. You unmute your mic, Keisha.
Yeah, yes, I know they did, but I can't remember. Maybe if you call the names, I might remember.
Do you have a copy of that report that you have fibroid?
Yes, I don't know where it is, sir. It's been a long time, sir. I transferred, so I moved from state to state, so most of those documents might not be close to me, sir.
Where are you currently living?
I'm in Abuja, sir.
Okay, so this is what I'm going to do. I'm going to explain the concept and the three major types of fibroid, okay? Now, generally, once you have a womb and you're a woman, which by default you are, the possibility you might have fibroid is there, especially if you're Black origin. So long as you're a woman within your reproductive phase of life, fibroid is very, very, very common. Up to now, we don't know the exact cause of fibroid. We know some risk factors, but we don't know what actually leads to fibroid, like proper direct correlation. Now, what I want you to focus on are the positions where you might have fibroid. So there are three types of fibroid you can have. Now, of the three types, there are two types that can affect your ability to become pregnant or lead to miscarriage. So those two types are the one inside your womb. The first one is what we call submucosal fibroid on the cavity of the womb. The second one is the one we call intramural fibroid on the wall of the womb. Now, the third one is subserosal. So of all the three I mentioned, the ones that will concern you regarding having a baby are the one on the inside and the wall. The one on the body of the womb can still be a problem if it's big enough. It can it can occlude the tubes. And when you occlude your tube, possibility of pregnancy naturally is gone. Now, the criteria for removing fibroid, if you want to have a baby, is based on the location first. So if those two fibroids, if the type of fibroid you have is intramural or submucosal, that's number one criteria. You've checked that box. The second criteria is bigger than 5 cm. So there are some women that will have a combination of the three of them, but the ones inside the womb, if they are bigger than 5 cm, you've checked the second criteria. The third criteria, the symptoms. There are some women that when they have fibroid, they bleed a lot, they bleed in clots, they have a lot of pain, their belly is swollen and all that. So these are the three criteria we are going to use to decide whether you're going to go for myomectomy. Myomectomy is the surgical removal of those fibroids. And if you want to become pregnant and you have this type of fibroid, we first of all want to remove it because you can see your womb. For pregnancy to happen, we want your womb to be as clean as possible. Now, because fibroid also feeds off your hormones, especially the estrogen, and during pregnancy, estrogen tends to be more elaborated. So during pregnancy, if you have fibroids and if they are big enough, if you didn't remove it, Possibility is gonna grow big is there, and when it grows big, it can put a lot of pressure on your baby. That's how it can cause miscarriage, or it can compress your baby, and your baby might be small for gestational age. That means your baby that should be a bigger size might no longer be a bigger size, or a couple of other things that can happen to you. So what you need to do is to make sure you consult with your doctor, and they will give you exact classification of the type of fibroid you have, and they make recommendations. From my experience, so many women we recommend myomectomy for will be so afraid. Oh, I heard my friend did it and went to heaven, then I'm not gonna do it. So a woman can actually be, having like 3 cm fibroids, which by then we are kind of being, kind of decisive. And when you get to 5 cm, we'll tell you, okay, go and remove it. You might still be playing about, oh, I don't want to remove it. But by the time you come back, that 5 cm can be 8 cm or 9 cm. So the bigger the fibroid grows, the more it's going to give you a lot of symptoms. And the more it can also lead to inability to you become pregnant or to cause miscarriages. And I heard you mention placenta abruptio, placenta previa, and all that. These are all other independent complications that can happen in pregnancy. So what you need to do now, we need to classify the type of fibroid you currently have after delivery. We need to know the size. We need to know the exact location. Then we need to know the symptoms, because right now, you're still going to be observing 18 months after delivery. Every woman is given a chance to allow their body to recover before you become pregnant again. So these are the things you need to discuss with your doctor. And you have to be very mindful, because right now, if before you become pregnant again, they have to do a workup to make sure that whatever fibroid you have is not going to affect the outcome of your pregnancy. I hope I made it clear.
Yes, and Dr. Chudi, so that you can maybe also add this to the yes. So when she talked about placenta previa potential abruption, that's probably because the placenta is trying to compete with the fibroid where to implant, right? Can you explain what that terminology means so that people can understand when she said so?
So when you have the placenta, which is a very important component in the whole baby making process, if it's low lying, if it's very, very close to the cervix, it can actually, impinge on the normal function of the role of the placenta, and that can be very, very problematic. Some women can bleed and it can complicate the pregnancy. So it's important when we diagnose this, we manage it appropriately as we should. Now, when you have placenta, of course, I can't show you the placenta component here because this is just a bland female reproductive system. Now, when you have placenta abruptio, it means the placenta detached. So abruption means it got abrupted. So the placenta detached way ahead on time when it's supposed to detach. Because part of the things that happen in your body before you eventually have a baby is to make sure the body is getting ready. So there's a specific time the placenta is supposed to go so that the whole birth process will go on. But if your placenta detaches early, you can have that condition we call placenta abruptio. And in lieu of the other one. So now you've had placenta issues, you are now at risk. So when you want to become pregnant again, you're going to look for
his network. Yeah, in the meantime, while he's coming back, ask non-reproductive questions. Or we'll take non-reproductive questions, and we don't have any more non-reproductive questions, then we'll take those. Your thing went off, Dr. Chudi.
Can you guys hear me now? Am I okay now?
Now, yes, you're back now, yes.
I want to believe I've explained everything. So if you have any other backup question, you can always come to my community.
So question, Dr. Chudi. So could the fact that she has the fibroids affect the implantation of the placenta and put the baby at risk or the pregnancy at risk of having a placenta abruption or placenta previa? Does that, because she said they were telling her that she has. Go ahead. Yes.
It can be a factor. It can be a factor because remember, everything in the womb is of a specific size, right? So when the whole architecture and the way the womb is designed is distorted, yes, it can happen. So it can compete.
Okay. Yes. So that's what I was trying to be. I wanted you to answer that question for her. That may be the reason too why maybe she said they were telling her she has all this placenta. Okay. All right, thank you very much.
It can happen independent, but it can also be a
Independently.
contributing factor. Yeah.
Okay, thank you.
Sir, and after delivery, I went through so much pain. I had so much pain after delivery.
9-8 love game. Please, you have to grab a hard meat for us to answer your question.
So all those pain you're having can also be due to changes that happen in that fibroid. So or that once you have fibroid, one of the presenting complaints of fibroid is pain. So we need to do something about that fibroid before you become pregnant again. Please don't try and become pregnant again without dealing with the fibroid.
Thank you very much.
If you don't have any questions, I'll drop you down actually so that I can give room for anybody else that can come up. Thank you, Dr. Chudi and Kisha. So there are other, besides reproductive questions, there are many other questions that you guys can ask because, I want to think that something, you may have a parent that has a problem or a friend or a family member that has an issue that maybe you've been wondering about and which we can provide some answers, So are there any other non-reproductive questions? If we don't have any before we can go to reproductive questions. Yes, someone was trying to speak. Yes. Okay. No? Okay. You don't have any questions regarding sepsis? You know what that means? You don't have any question regarding bleeding? Like some of the topics we talked about for those who have been here, can keloid be treated? That question is for a dermatologist, but I know that sometimes, some people will tell you that if the body already has a tendency to heal by forming excess tissue, there's always that risk that it may happen again. But I'm not an expert in that. It's either if a dermatologist, someone that deals with either plastic and with cosmetic surgery. But I think cosmetically it can be removed. But I also know that you can still have it again. Okay.
Have it again as in when it's removed or
Yeah, so for the healing, yes, the healing. Because I remember asking one of the plastic surgeons about that because I had a little a procedure that had almost like it wasn't even like big keloid, and I asked him about it. He said chances are that it could happen again. So I really don't know, but I think it can. Nowadays they have things, but I can't really give you an answer because that's not my area of expertise. Okay, so you see, she just said it. Yes, mine was removed and it's coming back. Yeah, so if some people have a tendency to heal by forming keloids, there's a chance that it may come back again. But yes. All right. So let me see. Someone asked, can we classify fibroid as a genetic condition?
Ask me that.
All we have today is about reproduction. Okay. So it looks as if nobody has any other question other than about reproduction today. So are we trying to say that all this, everybody that's listening has no other medical, maybe because they're all like younger females, so they're healthy? You don't have any parents that has any problems with asthma or children with asthma or COPD, like difficulties breathing? Any questions about the heart? None of that. Okay. So
I think I'm gonna stand out so they can focus on your community. I think I'm a confounder now.
It's fine. So let me see. Okay, good. So I'm going to bring you up blind date and love, okay, for your question, so that at least you can answer some of the questions from Dr. Chudi. Okay, NJ Foundation, I'll bring you up. Good evening,
Dr.
welcome
Chudi.
on board.
Yeah, thank you. Dr. Chudi, I would like to ask about, I want a little in-depth about PCOS, if you don't mind.
Muted or not?
Okay, can you ask specifically your question? You know, PCOS is a big concept. So what about PCOS do you want to know?
Okay, PCOS and weight gain.
Okay. Okay. So
How can it affect a woman from getting pregnant?
Okay. Okay. Now, PCOS stands for polycystic. Polycystic. Hold on, let me put my camera on again. So polycystic means you can see this picture, right? This is your ovary. So the major foci of PCOS is in the ovaries, right? So normally the ovaries is where you have your eggs, and the eggs are inside the follicles. When you have polycystic ovary syndrome, it means there are multiple fluid-containing cysts. So cyst is like, fluid-containing structures inside your ovaries, both ovaries. And when this happens, it will distort the normal function of the ovaries. Ordinarily, your ovaries, it's the place the eggs stay, and when the signal comes from the hormones, it will tell the ovaries to release the egg and you will ovulate. So what happens in polycystic ovary syndrome, you will have all these multiple bodies which contain fluid in the ovaries, and they will distort the function of the ovaries, and the woman will begin to have hormonal imbalance. When you have hormonal imbalance, it means the reproductive hormones you have as a woman, which ordinarily should help to prepare the release of the egg, will be abnormal. So one of the presentations in polycystic ovary syndrome is reduction in estrogen and increase in the hormones you're supposed to have at a minimal level. So the hormones that will go up are the hormones we call androgens. Androgens are hormones we want to go up in males. So when that happens, there will be a complete flip in the ratio of the androgens and the other female hormones that should help you to ovulate. So bottom line, in women that have polycystic ovary syndrome, especially the severe form, it's a preponderance. So an opportunity for the androgens to go up. And when it goes up, it will stop the body from ovulating. And if you can't ovulate, you can't become pregnant. Now, as if that one is not enough, the body will start having problems with the way the body handles insulin. So one of the things that also happen in women that have polycystic ovarian syndrome is the poor sensitivity to the insulin that ordinarily should handle the way the body handles sugar. And when that happens, you begin to accumulate a lot of body weight. Now, can women that have normal body weight still have polycystic ovary syndrome? Yes. But it's mainly commoner among women that will have body weight, and they will begin to accumulate all this body weight. And when that happens, it will continue to make the condition also worse. Now, some women with this condition, because they've had an increased level of the androgens, will start presenting with some symptoms as if they are men. One of the presentations is having facial hair, which we call hirsutism. Now, of course, the irregular period is going to be all over the place. Then some women might start losing their hairs. Some women might also have when they talk, they will talk like even if they are men. And of course, they will have acne. Acne is what you guys mainly call pimple. Okay? Now, these are all outward manifestations, but the bottom line in polycystic ovary syndrome is the lack of ovulation. So the critical management protocol in polycystic ovary syndrome is to get the body back to a stage where the body will still start producing the eggs so that the body can start preparing the eggs for pregnancy. Now, of all the ways to manage polycystic ovary syndrome, besides using drugs and all those hormonal approach, one of the ways you can flip your lifestyle and you can gain back a lot of control is to lose body weight. So you have to make conscious effort to lose all those body weight you're adding, because when you lose them, for example, if you lose 10% of your body weight, you can reclaim your fertility by 5%. So generally, women that have polycystic ovary syndrome should make conscious effort to modify their lifestyle to control their body weight, because when you don't control your body weight, it's going to further exacerbate and complicate an already complicated situation. So when we are giving you ovulation induction drugs and a couple of other treatments, you should also work on reducing your body weight intentionally, proactively, because when you do that, possibility of you ovulating and becoming pregnant will be high. I hope I explained it well.
Yes, thank you so much.
Very, very well, Dr.
Very,
Chudi.
very well.
Very well. Thank you.
Thank you.
So, just a reminder again, please. We'll answer all questions, but make sure that you grab a heart me. At least support. You're coming in here. We're grateful that you're here to watch the live, but you also have to encourage us. You also have to be able to encourage the host. So, if you want your questions to be answered, we can bring you up, but just please at least a heart me. We're not asking for a lot. Thank you, Blind Date. Thank you very much.
Okay, thank you. I'll go down now.
Thank you. All right, no problem. You're welcome. Thank you. So I think there are two questions. Someone asked a question with abdominal pain. Welcome, Michelle DNP. And so I will bring you up, but grab your heart me, please. Let me see. Who was that person? Because of the time, I don't have any moderator, some kind of moderating. Rachel Odinaka, please grab a hand me in order for me to bring you up or to answer your question, please. Let me see. Who else? Someone else also asked a question earlier.
Doc, did you see Mayo's apps question? I think you can answer that. It's kind of in the middle.
Somebody asked, what was that? What was the question?
Weight loss and...
I see Melly. Okay, I just see now. Is it healthy to take weight loss medication while trying to get pregnant? Oh.
Is that a bad thing to say about your mom? That's a good thing, right?
I don't see why not, in the sense that it's not so much the... let me put it this way. Provided the weight loss medication is by itself is not contraindicated for pregnancy, because you have to be careful, because sometimes you before you realize you may be pregnant before you even know you're actually pregnant. So you have to consult with your doctor, and then you have to look at that weight loss medication to make sure that it's not one of the ones that can give any cause any birth defect. But nowadays, even the GLP ones, the ones that they use, these are medications that have been used for diabetics. So we have to look at the category of you have different categories of medications. They categorize these medications differently, and depending on the category, what is it, category C or X, so that will give you some ideas to whether you don't even have to take it, because you may have a increased risk of causing some birth defect if you conceive. But you want to talk with your GYN or your gynecologist or your OB doctor, obstetrician, to guide you with this. Dr. Chudi, yes, you can chime in. Yes.
Yeah, can you guys hear me? Doc, can you hear me?
Yes, we can hear you, Dr. Chudi. We can hear you very well.
Okay, so here's the deal. Two parts. If you're planning to become pregnant and you're doing your best regarding your weight loss, I'm a minimalist when it comes to drugs and medications. The best way to have a control over your body weight is to eat right and stay active. Nothing compares to that. Now, will some people require medical intervention sometimes? Yes. There are some people that have morbid obesity. There are some people that might have endocrinology-related obesity or weight problems. So it simply means there is something metabolic, something in your body leading to that. So we can come in and intervene. Now, you have to make sure you work with your doctor. You have to make sure you pass all the level of screening and you qualified. Just like Doc mentioned, there are categories. So any drug you're taking will categorize it into A, B, C based on toxicity or how it can affect pregnancy. So if you're planning to become pregnant, yes, to an extent, you can do all these weight loss thing under the care of a provider, not by yourself, not the ones your friends will go and recommend for you. Now, when you're done doing that, remember to still keep an eye for preparations for pregnancy by taking your prenatal multivitamins. But once you are pregnant, everything weight loss ceases. There is nothing like I'm watching my weight during pregnancy. We don't do that because pregnancy is a state that can go south anytime. So it's very rare to see a pregnant woman that will still be going through all this, weight loss, that, because it can really backfire. So you can prepare yourself, body, mind, spirit prior to pregnancy. But once you're pregnant, you need to be ultra careful. Unless you have what we call morbid obesity, and we need to have interdisciplinary approach to your management, then we are going to involve everybody, including the dietitian, the endocrinologist, your cardiologist, everybody. Because the overall aim of becoming pregnant is not just to answer a pregnant woman, is to have a healthy baby. So bottom line, work with your doctor. If your doctor certifies you okay to use any weight loss thing, then make sure you tell your doctor expressly that you want to have a baby. It's going to make a difference how you're going to be managed. If you're intending to have a baby, they will be more mindful of the drugs they're going to give you, and they will be more mindful of making sure you're protected.
Okay. Thank you, Dr. Chudi. Thank you. Okay. All right. So, did that answer your question, Millie app? And if not, do you want to come up? If you have any, if you feel that you want to be in the box, okay, you're good. Okay. All right. So let me see if someone else had asked a question. Somebody was talking about their belly hurting or something like that. Let me see if I can find that. So I wasn't sure if it was.
NJ Foundation is already in the box, and I believe she fulfilled the criteria.
Oh, NJ Foundation. Oh, yeah. You had a question, right? Or didn't she ask a question? Oh, you had no. Sorry.
No, that's okay. That's okay. Good evening,
I'm telling you, I'm the moderator and everything, so my brain is even not focused. I'm trying to look at comments. Yeah, go ahead.
I said I want to break the oath today. Let me get to the box. Well, I was trying to ask a question concerning the breathing. I demonstrated asthma in 2020 when I had severe COVID, and they now started tracing the asthma because it got so severe. The COVID got so severe that I went to the ICU for some days because I have underlying, which is asthma. And I have never really demonstrated like having a crisis or something, no, until when I had COVID. So with that, after the treatment and everything, I had so many after effects. But my concern is when after that, when I get angry, it's like my lungs just swell until I have airtight. If maybe something really touches me somehow, I didn't expect, I just feel like I begin to have airtight. So knowing that, I started trying to avoid. Now, medically, I don't know. Is there a treatment to that? I have been booked for sleep apnea so many times, but they just tell me to always have my spray. I have never used it. I just make sure I get a new one each time it expires. But now I'm a little bit scared because today with pregnancy, I'm thinking of how will I manage that? Can that not lead to eclampsia or preeclampsia, something like that? I'm sorry, I'm calling this way. I'm not a scientist, so it's just research. I'm trying to think ahead of time. So it's scaring me. I don't know if...
So in other words, you're going to Dr. Google.
Not Google, Uncle AI.
Uncle AI, okay, yeah, AI, yes. All right. So you've said a few things that we need to unpack.
Okay, thank you.
So So before the COVID, the SARS-CoV-2 virus that caused COVID, were you ever diagnosed with asthma? Were you diagnosed with asthma
Never,
before that?
never. I
Okay,
was
all
just
right.
like, okay.
So after you had COVID and you ended up in ICU, what were your symptoms? Were you coughing? Were you wheezing? Were you having chest tightness? What was it that you were having?
I was wheezing, and I had that chest pain. Those were my symptoms.
Okay. And you said they gave you an inhaler that you use sometimes, right?
I never used it. It's after COVID I was advised to.
Yes, I know. I know. You said for the asthma that you said they diagnosed you with.
Yes.
You do use this when you're wheezing. So when you use the inhaler, does it help when you have the chest tightness or the wheezing?
What I used was nebulizer during the COVID treatment. After COVID, I have never used anything because I have never had a crisis. But now I am scared because when I get angry.
One second. Yes, because I'm trying to even tease out how they diagnose the asthma. Okay.
Okay.
So after COVID, okay, say you had COVID.
Yes.
I mean, when did you start developing the wheezing and the chest tightness that led to being diagnosed as asthma? Is it like 2 weeks after the COVID, a month after COVID, 2 months after COVID, roughly a year after COVID?
When I started being sick, that was when I started wheezing and having chest pain. So when I went to the hospital,
the wheezing and the chest pain was what led them to diagnose you with COVID.
With COVID, yes.
Okay, all right. So
because, go ahead, Doc.
So after I understood what you told me, but I'm just trying to tease out because it may not even be asthma. Okay, because not everything that wheezes is asthma. That's what I'm trying to tease out. Whether you had what they call post infectious bronchitis, and it's yes. So that's what I'm trying to tease out here.
Okay.
So what year did you get COVID? Let's start from there. Maybe yes.
2020. COVID came in 2019 December and 2020 March.
Okay, March. Okay. When did you get over the COVID? Was it in the same March or April? Just roughly.
Roughly April ending.
Okay. Now, after April ending, when did you start having breathing problems? That so say in May and June, were you now still having breathing problems that led to the diagnosis of asthma?
No.
Okay. So then, why did they think you have asthma?
During that period, because of the ways how severe it took me down, they now started asking me like background questions. And in the course of the background, it shows that my kid brother always had asthma until he was like maybe 18. Then he outgrew it. Now, he only has asthma when maybe he gets angry. That's when you see him start shivering and all that. Now, I had to talk with my mom, and my mom said, yeah, my grandmom has asthma. But my grandmom, like me, until her old age, then we could hear her wheezing. But we never knew it was asthma.
Okay. How old are you?
Don't know before social media, no.
No, it's not. It's not about because I had a whole course.
I'm in my 30s.
Okay, good. Yes, okay. There's a reason I'm asking. It has nothing to. I'm not really interested in your age per
not
se.
you, my village people.
Yes, it's fine. Just in your. It's fine.
Yes.
I don't know why women hide their age, anyways. But
My
yes,
village
what I'm
people.
trying to say is because I did have a lecture on asthma, and there are certain risk factors. I'm trying to tease out the risk factors here. Okay. So this is 2020 when you had your COVID, and since 2020, you have episodes where if you are stressed out, you have chest tightness. So and when you have those episodes of chest tightness when you're stressed out, have you ever taken a nebulizer treatment or a puffer? Do you have an albuterol or anything for
I have it, but I've never wanted to take it. I've never taken it.
Okay. And so when you have the chest tightness, it goes away by itself after maybe you relax. Is that what it is?
Yes. I just need to go away from there, calm down, and it will take time, and I will come back.
Okay, and during allergy season, are you based in? I don't know where you based. Before I say allergy season,
I'm in Delaware.
Okay, so during spring, do you tend to have a lot of allergy symptoms, sneezing?
Yes, I do.
Congestion, nasal congestion, maybe
Yes, I
itchy
do.
eye. Okay,
Yes,
good.
I do.
All right. And when you were growing up, do you know if you had eczema or was that something like that, or do you have any children who have any breathing issues?
No, what I had was what I had. My grandma used to say is measles when I was small.
Okay. All right. So right now, although you have the emergency inhaler, you rarely use it.
I've never even.
Okay. So your concern now is that if you get pregnant, will the asthma get worse? Is that the concern?
Yes. Oh, is there a way I can remedy it?
So okay. So let's just talk about asthma a little, like give a little synopsis. So yes, there are some risk factors that can predispose people to have asthma. Okay, family history, that is true. If you have especially first degree family members, say being your parents, your siblings, that actually puts you at risk of also having asthma. Sometimes some people may have asthma at their older age, and that is usually even related to hormonal levels. Sometimes when you have a respiratory infection also, it may trigger somebody who is already predisposed, meaning that they have some other factors that may put them at risk of having asthma. So after a respiratory infection, it doesn't have to be COVID, it could be any respiratory infection that can make them more susceptible to start having problems with with wheezing or coughing and shortness of breath. And then yes, some people maybe with stress, maybe there's that background that there's a family history, and it does manifest itself like you say. Generally, if you use inhalers, those inhalers, especially the albuterol, is supposed to open up your lungs, so they'll call what they call bronchodilation. So they may help. Now, in terms of pregnancy, I've seen it two ways though. Sometimes some people actually do okay with their asthma. We're talking about patients that were already having a lot of asthma symptoms. During pregnancy, their asthma may get better. In some cases, they may get worse. But in that case, even, the good thing is that you're in a place where you have pulmonologists, you have other specialties and amenities that can handle even high-risk pregnancy. So you already, from what you're telling me, you don't even have, if we even had to categorize you as asthma, it's going to be what they say mild intermittent, meaning that you even rarely even need your inhalers.
Yeah.
So you shouldn't be at any major risk even to have any crisis. But that doesn't mean that if you're pregnant you won't. Because even with patients who have moderate persistent or severe persistent, meaning that patients who are actually on daily medications to keep them their asthma controlled, those patients can still become pregnant and they'll still do fine. So I don't think it should be a major concern with you. And if you start having problems, you just have to have you to see a specialist so that they can go ahead and put you on the right medications.
Thank you so
Now,
much.
no problem. Now, you mention something else also that I was going to address? Okay, that's yes.
I thought of leading to eclampsia or eclampsia.
Okay, good. Yes. So that's something. Let me see. Dr. Chudi dropped off. So let me 1 second. Let me see if I can bring him back. He's here. Yeah. Well, you just dropped, Dr. Chudi. Your network. I'm sure your network. So preeclampsia is a totally different thing. It has to do with high blood pressure. It has nothing to do with asthma. So Dr. Chudi, maybe you can preeclampsia to eclampsia. Asthma has nothing to do with that. Yes.
Yeah, of course, you're 100% correct. There is absolutely nothing asthma has to do with your preeclampsia and eclampsia. What you should be more mindful of. Do you have a family history of hypertension? Are you hypertensive?
Yes, I am. After COVID,
I remember now. Remind me afterwards. We talk about sleep apnea. Yes, I remember that was what I wanted to talk about because she mentioned that.
Okay,
After
so
COVID, I developed blood pressure.
okay, so are you currently on any medication?
I was taking amlodipine, something like that, and another one, and they stopped amlodipine, and they asked me to continue with one. Let me get it, please. I have it
Okay,
right.
so okay, no, you don't have to.
It's
I'm
fine.
okay
It's
with it.
fine. Yes, it's fine. I
I'm
think you
okay
just
with
meant
the
to
regimen.
that your blood pressure is
Even in
controlled.
this sense, you know,
Yes.
Correct.
these
So
things.
your
When you
blood
do your
pressure
back
needs
to
to be
come here,
controlled, and you need to be very, very extremely careful.
which kind
Now,
of thing is?
I was, kind of amused when Doc was asking you your name, your age, and you were,
Oh my goodness.
being about it. Just so you
My
know, the
village people are
biggest, the
here.
biggest, the biggest, the biggest, the biggest factor, the biggest data we need in anything medical is your age. So if there is anybody to tell your age, exactly your age is your doctor. If you don't want to do it in
I
the
say,
open, we can
well, no, in
understand.
this sense for
Now, make
this
sure
Amadi
that your
community.
blood pressure drugs, you're taking it religiously. Now, I also heard you say they gave you some drugs for
On
inhaler, but
what?
you're not taking it. You should not be the person that will decide whether you're going to take a drug or not. That's a very big mistake you're going to make. So please, if you have any concern with the drug your doctor gave you, or you have adverse effect or side effects, piggyback to your doctor, because when you take drugs at will, when you want or when you don't want, you can be in trouble. Now, what's your body mass index? Do you know your body mass index? How much you weigh and all that?
I do actually I'm on metformin.
Yeah, because she talked about sleep apnea. I kind of
Are
suspected
you
that.
saying that thing for me?
Are you diabetic?
I was on borderline.
Okay, so do you know why we are asking you all these questions?
I can
So if you're down with diabetes, you're down with hypertension, you have asthma situation, you've got COVID, and on top of that, you want to have a baby and you have apnea, you really, really need to be extremely careful on the front seat of the church. Okay, because they are all gonna combine to lead to what we call comorbidities. So Doc is gonna talk more about her own point, but for you, the fear of preeclampsia, yes. If you have hypertension and if it's poorly controlled when you become